The Coordinating Minister of Health and Social Welfare, Professor Mohamed Pate, says the federal government's strategy of working closely with state governments to address malaria-based and of their specific needs is yielding positive results. Professor Pate made this known at the 2026 edition of the Leadership Development Course on the Science of Defeating Malaria, which held in Abuja. He notes that the prevalence of malaria has declined, and the government is expanding access to primary health care services, improving affordable health care coverage through health insurance, upgrading health infrastructure, strengthening the healthcare workforce, increasing local production of diagnostic test kits, pharmaceuticals, and insecticide-treated mosquito nets.
2 years ago, 3 years ago, we had a rethinking malaria effort here in Abuja, and RBM was here. We just stepped back and looked at this whole landscape. And in the context of, after that, we then crafted this effort, the strategic plan that is fit within our context with the costing of that, the subnational tailoring, because what is happening in Zamfara, what is needed in Zamfara is different from what will be required in Bayelsa. Looking at the various facets, the data, what data we need, not only the epidemiological data, the program data, the genomics data, many of those new tools that are needed to sharpen our understanding of the disease in our own context, but also how do we link with other countries in the sub-region. So those are the shifts that we've begun to undertake in the context of malaria elimination in Nigeria. And I think we're beginning to see results. I think almost a third-fold reduction if you compare 2010. Many of our states are moderate transmission states. We don't have any in high transmission, high burden states. Those are indications that it is in fact possible. It is not easy, but it is possible.
I would say that we're making progress with 15% prevalence. We really need to sustain the effort so far. So in the sustaining of this effort, we need, science. We need to understand, the science of this infection and how to implement. We also need to discuss innovation, R&D, in terms of malaria, the vector,